So let's go through the anatomy of the clam. So the clam holds its shell shut with these two adductor muscles, which pull it shut. And there is an anterior adductor muscle, which is near the mouth here, and the posterior adductor muscle, which is near the siphons which transport water. Just inside the shell is a very delicate membrane known as the mantle. The mantle secretes the shell and does a few other tasks, like it performs some gas exchange. So here you can see the mantle here. This is what lines the shell, produces the shell. It performs some gas exchange, and then in addition, um, it then also has cilia, which help to move water. Now, the hold on just a second. The key to a clam is the movement of water. So on the posterior, we see these two siphons. There is an inhalant or incurrent siphon where water comes in, and then water can leave through an exhalant or excurrent siphon. Water comes in bringing in oxygen and food particles. The oxygen can be removed here at the gills. So here are gills. There is this pair of flaps on either side. So here's a pair of lamellae forming gills there. And then as you can see here, then there is the pair of lamellae forming gills here as well. And this then is where a gas exchange occurs. Now there are cilia here which help to move the water. And as the water moves, then food particles can become trapped and swept towards the mouth, which is in between two labial palps. So here you can see a labial palp, which helps to manipulate food particles towards a mouth, which leads to an intestine. Between the gills, we see the muscular foot. This is what a clam can use to burrow. This is what a snail can glide along. And in an octopus or a squid, this is what can be divided into tentacles. So here's that muscular foot here. The intestines will then bring waste near the exhalant siphon. So as water is leaving the body, it can eliminate waste as well, in addition to having gametes pass into the open water. If you dissect into that visceral mass, this is where the mouth is locating, leading to a coiled intestine. I hate to use other terms like things like stomach, because that would not be a homologue of the stomach present in invertebrates by any means. There is a pericardial cavity and a heart, although this would be smaller because um, these clams have an open circulatory system. So they don't need to generate as much pressure, so the heart is thinner walled. The body cavity, the coelom, includes the pericardial cavity, but not most of the rest of the organs. And so this visceral mass then includes some of those systems.